Hi, I'm Dr. Jeff Rohde with Dental Compare. Today we're here with Noel Wilford from MIS Implants. They're introducing a new product here in Chicago. Now, you guys do implants, but this new product isn't really implant related. How did that happen?
We truly try to be a very full-service implant company, and what we've done this past year is to incorporate a new division for the company, and it's called our Oral Health Division. And so this is where this new product falls.
So now this new product is called PerioPatch.
Right.
How's it work?
Okay, the PerioPatch, it's a hydrogel barrier, and it acts in two different ways. It's a small patch that can go over any sort of an area in the mouth that needs to heal, and it works by being a physical barrier over the actual wound, as well as it absorbs the excess wound exudates. So it creates a more natural environment, and it promotes healing, as well as reducing all the signs and symptoms of inflammation. So we're talking redness, we're talking discomfort, we're talking swelling. In addition to the outside physical symptoms that a clinician would see, we also know that it does have an impact on the inflammatory biomarkers.
Right, so it's almost like a little sponge pulling the bad stuff out so the wound can get to healing.
Well said, I like that analogy, and I'm going to use it.
No problem at all. So what kinds of things are you finding this to be effective on?
It's very effective for post-surgical times, post-scaling and root planing. It's very helpful for kids who have braces and the inside of their mouth is always beaten up. When someone places a retraction cord and it's always very sore after that, there's just any time that healing has to take place, we know that there's an inflammatory response, and it does help to reduce those symptoms.
So you can also use it for cases like for traumatic type things, like say you bite your cheek or you burn your palate with pizza burn kind of thing?
Absolutely. It's very, very helpful, and it sticks to any moist area, but as far as cheek bites go, we have a great series of photos from a woman who works with us who bit her cheek. She used a PerioPatch, and in less than 14 hours, that area was almost completely eradicated.
That's great. And during that 14 hours, it also protects it so she can actually eat and carry on normal.
Right, right. When the patch is first put on, there's an outer backing that is a carrier for the hydrogel layer. That backing will stay there for about an hour, and then it comes off. And then you still have that hydrogel layer beneath it, which also acts as a protective mechanism in addition to absorbing those excess wound exudates, like you said.
That's great. Now, if I'm a dentist and I want to have this in my practice, am I distributing this to my patients? Is
Exactly.
that how we do it?
Yep. We will sell a box of the patient packs of the PerioPatches to you. There are 5 patient packs in a box, and then you can distribute it to the patient as you wish.
So now, one thought I had is every once in a while I still have a patient that comes in, they did that thing where they put the aspirin right next to that tooth that was hurting, and rather than helping the tooth, it burned the tissue. Is this something that we could use for that?
Yep, absolutely. It's going to be very helpful for a burn like that, as well as when patients are undergoing a bleaching process and some of the solution leaks out from under the tray and they burn the tissue. It's been very, very helpful for that as well.
That's great. That's great. Well, Noel, thank you so much for your time.
Thank you so much, Jeff.
The all-new PerioPatch from MIS Implants.